Laughter bounced off the white tiles the moment the young doctor in oversized scrubs walked onto the night shift. "Babysitter, rotation again," a resident snorted, his voice dripping with condescension. Another jabbed a thumb at her badge with theatrical emphasis. "Temporary coverage? Keep her away from anything that bleeds." Their giggles grew louder when the chief surgeon passed, barely acknowledging the newcomer with more than a dismissive glance. But the joke ended the instant an alarm wailed from Trauma Bay 3, and every seasoned hand froze, their confidence evaporating, unsure what to do next. They laugh because they don't know me. That's fine. I'm here for the patient whose heart just stopped, not their approval. I count chest compressions the way I once counted mortar blasts, steady, detached, alive. If I hesitate, someone's child dies and another ghost follows me home. So let them laugh. Soon they'll understand why silence can be the loudest skill on any battlefield. What happened after that flatline would shatter every assumption in this hospital. If you want to see how an underestimated doctor turns one chaotic night upside down, subscribe to Emergency Hero Stories now. Her next move will leave even the chief surgeon speechless. Because the moment her hands touched that lifeless chest, the entire ward's fate changed forever. The thunderstorm outside Metropolitan Memorial snarled like traffic in a tunnel, rain hammering against windows with relentless fury. But inside Trauma Bay 3, the noise shrank to a single horrifying silence. A 14-year-old motorcyclist lay motionless on the gurney, eyes half open, lips already turning grey. Nurses hesitated, exchanging nervous glances. The portable defibrillator had shorted during power flickers earlier, and nobody trusted the backup pads taped to its cracked casing. Dr. Elena Reyes, still the temp to everyone, stepped through the semicircle of frozen staff with purpose. "Palms up, 2-finger sweep. Make sure nothing's blocking the airway," she said, her voice cutting through the paralysis. The respiratory tech blinked, then obeyed. Elena grabbed the manual pump bag, checked the seal with practiced efficiency, and began ventilations in perfect cadence with compressions delivered by a trembling intern. Dr. Harrison, the senior resident who'd mocked her badge earlier, hovered at the periphery. "We can't shock. Equipment's fried." "Then charge your hands," Elena answered calmly, counting beats without looking up. "Switch compressions every 100 pumps. Fatigue cuts perfusion by 30%. He tried to laugh, but the boy's monitor still flatlined, the sound piercing and final. Elena's voice hardened. "Rotate. Now." Harrison obeyed, cheeks flushing red with embarrassment and adrenaline. 30 seconds later, a faint pulse flickered beneath his fingers. Another breath forced into small lungs. Another rise in the small chest. 2 nurses gasped simultaneously. A faint blip appeared on the screen, irregular but gloriously alive. The chief surgeon, Dr. Michael Stone, arrived just as the boy's heart kicked into a slow but sustainable rhythm. He surveyed the scene with practiced eyes, narrowing at Elena with curiosity. "Name?" "Elena Reyes, temporary coverage." Stone nodded once, measuring her. "Well, Dr. Reyes, you bought us time. Get this child to PICU before we continue with what happened next. Drop a comment below. Have you ever been underestimated and had to prove yourself in a high-pressure situation? We want to hear your stories." The boy stabilized under Elena's watchful care. His heart rhythm grew stronger with each passing minute, the monitor's beeping becoming more regular and reassuring. The nurses who'd snickered earlier now watched her with different eyes. Not quite respect yet, but something closer to curiosity tinged with shame. Who was this temp doctor who moved through cardiac arrest like she'd done it 1,000 times in her sleep? Dr. Stone pulled Elena aside as the PICU team wheeled the motorcyclist away, monitors still beeping their steady reassurance. "Where did you train?" His tone wasn't friendly, more like an interrogation, the kind reserved for doctors who didn't fit the expected mold. "Hopkins. Then emergency medicine residency at Mass General." "And you're doing temp coverage in a mid-tier hospital because..." the question hung in the air, loaded with implications. Eleanor's jaw tightened almost imperceptibly. Personal reasons. Personal reasons don't usually involve that kind of battlefield composure. Stone's eyes narrowed with recognition. You moved like military, like someone who's seen real combat medicine. I did 3 tours: Army trauma surgeon, Afghanistan and Syria, field hospitals under fire. The hallway went quiet, the usual hospital sounds fading into background static. Stone's expression shifted, not quite softened, but the edge dulled considerably. How long have you been back stateside? 8 months and 13 days. And I'm not cleared for permanent positions yet. PTSD review, standard protocol for combat doctors returning to civilian practice. Elena's voice stayed flat, medical, detached, like she was discussing someone else's chart rather than her own shattered career trajectory. Stone studied her for a long moment, processing this information. The temp agency didn't mention military service in your file. They don't have to. My license is current. My skills are current. My hands don't shake. That's all that matters legally. Your skills just saved a kid who was circling the drain, Stone acknowledged with grudging respect. But this isn't a field hospital, Dr. Reyes. We have protocols, equipment, support staff, proper procedures. You can't just... An explosion of voices erupted from the ER entrance, cutting him off mid-sentence. Security radio crackled with urgent static. Mass casualty event. Bus rollover on Highway 9. 23 injured. Multiple critical. Possible fatalities. ETA 5 minutes. The hospital's disaster protocol alarm shrieked to life, red lights flashing in the corridors. Stone's face went pale beneath his tan. We're not staffed for this. Half our surgeons are at a conference in Boston. We've got... He did mental math, his expression growing more panicked. Maybe 4 attending physicians in the building. Total. Eleanor was already moving toward the supply closet with military precision. How many trauma bays functional? 3. But we can't possibly handle... Then we use the hallway. Convert every available space into treatment stations. Triage outside before they even enter. Red tags to trauma bays. Yellow tags to hallways, green tags to waiting room for minor care. Elena grabbed armfuls of supplies, her movements efficient and purposeful. Get me every resident, nurse, and medical student in this hospital. Wake up anyone off duty. Now. Stone hesitated only a second. Old command instincts, recognizing superior tactical thinking. Then, his voice kicked into gear. You heard her! Move! This is not a drill. The next 4 minutes were controlled chaos orchestrated with military precision. Eleanor transformed the emergency department into a battlefield triage center, drawing on protocols learned under mortar fire. She positioned the strongest nurses at the entrance for immediate assessment, gave them quick instructions on color-coding severity, set up 3 treatment stations in the hallway with essential equipment meticulously arranged, assigned roles based on lightning-fast assessments of who could handle what under pressure. Dr. Harrison approached, his earlier mockery completely evaporated. Dr. Reyes, where do you want me? Airway management, Station 2. Anyone who needs intubation comes to you first. Can you handle that level of responsibility? Yes, ma'am. Good. Don't second-guess yourself. Trust your training. Trust your hands. Move with purpose. The first ambulance arrived with sirens wailing. Then the second. Then they just kept coming in waves. The bus had flipped on a rain-slicked highway during rush hour, ejecting passengers through windows and crushing others beneath twisted metal. Elena's triage was ruthless and efficient, honed by years of deciding who lived and died under fire. Red tags to trauma bays, yellow tags to hallway stations. Green tags got directed to the waiting area where medical students did basic wound care under supervision. A middle-aged woman arrived unconscious, skull fracture visibly depressed, pupils unequal and sluggish. Critical traumatic brain injury with active bleeding. Stone started to call for neurosurgery backup. "They're 40 minutes out minimum," Elena said, already assessing intracranial pressure with practiced fingers. "She doesn't have 40 minutes, maybe not even 20. Get me a drill and an ICP monitor. I'm doing an emergency burr hole evacuation right here." "You're not a neurosurgeon," Stone protested, his voice rising with concern. "No, but I've done 27 field craniotomies under mortar fire with half the equipment and twice the pressure. Prep her. We're losing her." Stone's objection died in his throat. He'd seen Elena work now. He nodded curtly to the nurses, who moved with newfound urgency. Elena worked with mechanical precision born of necessity. Local anaesthetic injected. Mark the site with surgical marker. Drill through skull bone carefully, feeling for the give. Evacuate the hematoma compressing delicate brain tissue. Monitor intracranial pressure as it normalized. The woman's pupils equalized, a small miracle. Pressure readings stabilized into acceptable ranges. "PICU for observation and secondary imaging," Elena ordered, already moving to the next critical patient without pause. A teenager with a flail chest, multiple rib fractures causing paradoxical chest wall movement that made breathing impossible. She was literally drowning in her own blood, hemothorax filling her chest cavity. Elena performed an emergency thoracotomy right there in the hallway, opening the chest to control internal bleeding that conventional chest tubes couldn't reach fast enough. Dr. Harrison watched in stunned silence as Elena's hands moved with absolute confidence through procedures he'd only read about in textbooks, procedures that seemed impossibly complex and dangerous. The cases kept coming in relentless waves. A man with massive abdominal trauma, liver laceration bleeding internally. A child with a severed femoral artery spurting blood. An elderly woman in septic shock from a perforated bowel, her vitals crashing. Elena triaged, treated, and stabilized each one with the same calm efficiency that had kept soldiers alive in desert field hospitals. 3 hours into the mass casualty event, the attending surgeons from the conference started arriving back at the hospital, summoned by emergency calls. They walked into an emergency department that should have been overwhelmed, chaotic, and failing, but instead was running like a well-oiled military operation. Dr. Patricia Chen, the hospital's chief of emergency medicine, surveyed the organized efficiency with wide eyes. "Who's running this operation?" "The temp," Stone said quietly, something like awe in his voice. "Dr. Elena Reyes, former Army trauma surgeon, 3 combat tours." Chen watched Elena direct a complex resuscitation while simultaneously consulting on another patient's imaging, her focus absolute. "She's military? Combat experience?" 3 tours, Afghanistan and Syria, field hospitals under active fire. "And we have her doing temporary coverage?" Chen's voice carried genuine disbelief and anger at the waist. "Get me her complete file, right now." By 4 a.m., every critical patient had been stabilized and properly assigned to appropriate care units. 23 people from that bus crash survived. A statistical miracle that would have been impossible without Elena's battlefield triage protocols and her willingness to perform procedures that civilian doctors hesitated to attempt without perfect conditions. Elena sat alone in the break room, scrub still blood-stained and sweat-soaked, drinking terrible vending machine coffee that tasted like burnt rubber. Her hands didn't shake. They never did anymore, no matter how intense the situation. That was one of the things the therapist noted in her PTSD evaluations, the disturbing steadiness that came from too much practice with death and crisis. Dr. Stone found her there, sitting in the harsh fluorescent light. He sat down across from her without asking permission, his own exhaustion evident. 23 survivors, he said quietly. The paramedics said at least 8 should have died before reaching the hospital. 3 more should have died in our ER within the first hour, but they're all alive, every single one. Elena sipped her coffee, grimacing at the taste, said nothing, her face unreadable. Dr. Chen wants to offer you a permanent position. Attending physician, emergency medicine, full benefits and privileges. She's willing to waive the usual PTSD clearance requirements given your performance tonight. I'm not cleared yet. The psych evaluation isn't complete. You just ran a mass casualty response better than doctors who've worked here for 20 years. You're cleared enough. Elena looked at him finally, meeting his eyes. I have nightmares, Dr. Stone. Bad ones. I see faces of patients I couldn't save burning in vehicles. I sometimes freeze in grocery stores because the fluorescent lights remind me of field hospitals. I'm functional, but I'm not fine. I may never be fine. Nobody's asking you to be fine, Stone replied with unexpected gentleness. We're asking you to save lives, which you clearly still know how to do better than anyone I've ever seen. The mocking will continue when they learn about the PTSD, the whispers in the hallways. The damaged war doctor, PTSD liability. Can she handle the pressure? I've heard it all before at other hospitals during my temp rotations. Then they're idiots, Stone said bluntly. Anyone who saw you work tonight knows exactly what you are. You're not damaged. You're a surgeon who learned medicine where every single decision was genuinely life or death. That doesn't make you broken. It makes you exactly what we desperately need. Elena was quiet for a long moment, processing. I'll think about it seriously. Fair enough. Stone stood to leave, then paused at the door. One more thing. That senior resident, Dr. Harrison, he specifically asked if he could work with you, be assigned to your cases. Said he wants to learn from someone who actually knows what they're doing under real pressure. The ghost of a smile crossed Elena's tired face. He called me babysitter rotation this morning. Yeah, well, he's an idiot too. But he's an idiot who recognizes genuine skill when it saves his ass and his patients. 2 weeks later, after careful consideration and consultation with her therapist, Dr. Elena Reyes, accepted the permanent position as attending physician in the emergency department at Metropolitan Memorial. The hospital administration had thoroughly reviewed her military service records, spoken extensively with her commanding officers, and concluded that her PTSD was well managed and didn't impair her medical judgment under pressure. If anything, it sharpened it. Her first official day, she walked onto the floor to find the entire night shift staff lined up in the hallway. Stone stood at the front, unusually formal. Dr. Reyes, he said with ceremony, on behalf of Metropolitan Memorial Emergency Department, we want to say thank you for the 23 lives you saved, for the example you set under impossible conditions, and for reminding all of us what emergency medicine is really about at its core. He gestured to the wall behind him. Elena's mouth went dry with emotion. Someone had mounted a polished plaque. It read, Dr. Elena Reyes, Combat Trauma Surgeon, U.S. Army. 3 tours, 23 lives saved, March 15th. We are honoured to serve alongside you. Below the plaque was a photo from that chaotic night. Elena, in blood-stained scrubs, focused entirely on a patient's chest, her hand steady in the middle of controlled chaos, intensity radiating from every line of her body. You earned this, Stone said quietly, sincerely. Welcome to the permanent team. The staff applauded, genuine and warm. Even Dr. Harrison, who'd mocked her temporary badge that first night, clapped with visible respect and gratitude. Elena felt something crack in her chest, not breaking, but opening like a door, long sealed. For 8 months, she'd hidden her military service like it was shameful. Like the nightmares and hypervigilance made her less of a doctor, damaged goods. But standing in front of colleagues who saw her skills instead of her scars, she realized something profoundly important. She wasn't broken. She was forged. Thank you, she said, her voice steady despite the emotion. I'm genuinely glad to be here. Her first official case as a permanent attending was a teenage girl with appendicitis. Routine, simple, standard procedure. The kind of case that actually made her hands tremble slightly because there was time to think, time to remember all the routine cases in field hospitals that went catastrophically wrong despite everyone's best efforts. But Dr. Harrison was there, assisting with newfound competence and respect. "You've got this," he said quietly, sensing her tension. "Just like the motorcyclist. Just like the bus crash. You've got this." Elena breathed deeply, focused on the present moment, made the incision with steady hands. The surgery went perfectly, textbook standard. Over the following months, Elena became something of a legend in the emergency medicine community. Other hospitals heard about the war doctor, who ran mass casualty events like military operations. Medical students specifically requested rotations just to watch her work and learn her methods. Trauma conferences invited her to speak about battlefield medicine applications in civilian settings, her presentations packed to capacity. She systematically trained the entire Metropolitan Memorial staff in combat casualty care principles. How to think clearly under fire. How to triage effectively when resources were critically limited. How to stay calm and functional when everything was falling apart around you. How to make impossible decisions quickly and live with the consequences. Dr. Harrison became her most dedicated student and protégé. The resident who'd mocked her badge now followed her like a shadow, absorbing everything she'd teach, taking detailed notes, asking thoughtful questions. "Why do you move so fast during codes?" he asked one night during a break. "Because hesitation kills," Elena answered simply. "In the field, if you stop to think too long, the mortar fire caught up with you. You learn to make decisions instantly and commit completely to them. That's the fundamental difference between combat medicine and civilian medicine. We had to be right the first time because there was no backup, no second chances, no do-overs. How do you deal with the ones you can't save?" "The losses?" Elena was quiet for a moment, choosing her words carefully. "You remember them. You carry them always, but you don't let them stop you from saving the next one. The dead don't need me anymore. The living do. That's where I focus my energy. The nightmares didn't stop completely." Elena still woke up at 3 a.m. sometimes, hearing explosions that weren't there, seeing faces of soldiers she couldn't save. Still flinched at loud noises. Still found herself automatically counting exits in every room, assessing threats that didn't exist. The hypervigilance was permanent, her therapist explained. Manageable, but permanent. But therapy helped significantly. Dr. Sarah Chen, her PTSD therapist, taught her effective grounding techniques. "When the memories come," Dr. Chen would say patiently, "remind yourself where you are physically. Name 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, 1 thing you can taste." Elena practiced this religiously, making it automatic. During particularly intense shifts, when the blood and chaos triggered vivid war memories, she'd pause for 5 seconds. Look around deliberately. Hospital walls, not desert sand. Fluorescent lights, not fires. American accents, not Arabic dialects. Safe, present, here, alive. The physical therapist she'd started dating, Marcus Webb, understood trauma in ways most civilians couldn't possibly comprehend. He'd worked with dozens of veterans returning from deployment, bodies broken but spirits refusing to quit, souls damaged but not defeated. "You're not damaged goods," Marcus told her over coffee one morning, his voice firm. "You're someone who survived impossible situations and came out stronger. That's not weakness. That's literally the definition of strength." Their first real date was to a quiet restaurant, deliberately away from loud noises and crowds. Elena had warned him honestly about her hypervigilance, about how she needed to sit facing the door always, about how sudden movements sometimes made her flinch involuntarily. "No problem," Marcus had said simply, without judgment. "I'll sit with my back to the room. You watch the exits. We're a team." That simple acceptance and understanding meant more to Elena than any grand romantic gesture possibly could have. She also found herself laughing genuinely with colleagues during lunch breaks. Real laughter, not the hollow kind that had become her default during the first difficult months back from deployment. The emergency department staff had evolved from skeptics to genuine friends who knew her story and accepted all of it. Dr. Harrison organised a monthly dinner for the trauma team. What started as 4 people grew organically to 15 regular attendees. They'd gather at a local restaurant, swap stories, decompress from difficult cases, support each other through the hardest moments. Elena found herself actually looking forward to these evenings, a connection to normalcy she'd thought she'd lost forever in the desert. She even took on a formal mentorship role with medical students, something she'd never imagined doing. Young doctors would shadow her shifts, watching in awe as she moved through chaos with practiced calm, learning not just procedures, but philosophy. "How do you stay so composed?" one earnest student asked after a particularly brutal trauma case involving a child. "Because falling apart doesn't save lives," Elena answered honestly. "In Afghanistan, we didn't have the luxury of emotional breakdowns during surgery. You learn to compartmentalize ruthlessly. Deal with feelings later, function now, save the living." "But don't you feel it?" the student pressed. "The weight of it all?" "Every single day," Elena admitted, "but I channel it into making sure the next patient survives. The ones I couldn't save in combat. I honour their memory by saving everyone I possibly can now. That's how I cope." 1 year after the bus crash, Metropolitan Memorial held a formal ceremony for the 23 survivors. They'd all returned to thank the medical staff who saved their lives that chaotic night. The 14-year-old motorcyclist, now 15 and healthy, stood at the podium with his mother beside him. "I don't remember much about that night," he said, his voice stronger than expected. "But my mum told me later that my heart stopped. That the regular equipment failed. That everyone froze except for one doctor who refused to let me die." He looked directly at Elena with tears in his eyes. "Dr. Reyes, you saved my life when no one else could. Thank you." The other 22 survivors stood simultaneously and applauded, many crying. Elena felt tears sting her eyes, the first she'd cried in years that weren't from nightmares or traumatic memories. After the ceremony, Dr. Stone pulled Elena aside privately. "The board is creating a new position specifically with you in mind, Director of Emergency Trauma Services. They want someone who can train staff in crisis response and advanced trauma care. Someone who's actually been through hell and come out stronger. They want you." "I'm still seeing a therapist twice a week," Elena said honestly. "Good. Keep doing that. The job is yours if you want it." Elena looked around the emergency department, the place that had started with mockery and evolved into genuine purpose. The staff who'd laughed at her temporary badge now looked to her for guidance and leadership. The patients who would have died were alive because she'd refused to let battlefield medicine be dismissed as irrelevant in civilian hospitals. "I'll take it," she said firmly, "on one condition. Name it. We start a formal program for military doctors transitioning to civilian medicine, support system, mentorship, therapy resources. Help them understand that what they learned in combat isn't a liability, it's an invaluable asset. Because the next Elena Reyes shouldn't have to spend 8 months doing temp work before someone recognizes what she's worth." Stone extended his hand without hesitation. "Done. Let's call it the Combat Medicine Integration Program." They shook on it. A partnership formed. 3 years later, the program had successfully placed 47 military doctors in civilian hospitals across the country. Every single one of them brought battlefield trauma skills that saved lives in emergency departments that desperately needed exactly that expertise and perspective. Dr. Elena Reyes became one of the most respected trauma surgeons in the entire region. Medical students competed fiercely for positions in her program. Hospitals requested her consultation on mass casualty protocols and disaster preparedness. The nightmares lessened significantly. Not gone, never completely gone, but manageable with therapy and support. She kept the photo from that first chaotic night on her office wall permanently, the one showing her blood-stained scrubs and absolute focus, captured in a moment of pure medical purpose. Below it, she'd added a quote from her military commander in Afghanistan. "The best doctors aren't the ones who never face impossible situations. They're the ones who face impossible situations and refuse to accept impossible outcomes. On particularly hard days, when the cases piled up and the equipment failed, and nothing went according to plan, Eleanor would look at that photo and remember. They mocked her because they didn't know. Now, they knew. And that made all the difference in the world. Sometimes the most valuable skills come from the hardest places. Sometimes the doctor everyone underestimates is the one who's already survived situations that would break most people completely." Elena Reyes walked into Metropolitan Memorial as a temporary physician with a hidden past and uncertain future. She walked out as a director who fundamentally changed how an entire hospital thought about emergency medicine and what was possible under pressure. Because the laughs that greet you don't define you. The lives you save do. And on the night when everything went catastrophically wrong, one combat doctor proved that battlefield medicine isn't about war. It's about refusing to let anyone die when you know how to save them. Have you ever been underestimated and had to prove yourself? Have you ever turned mockery into respect through sheer competence and determination? Drop a comment and share your story, because everyone has a moment when they had to show the world what they were really made of.